A luxury private hospital in downtown Dubai fell silent as a prestigious cardiac surgeon from Germany stood before an international medical conference, his designer watch glinting under the chandeliers as he dismissed what he called a primitive approach to telemedicine. He had just reviewed a presentation from a Filipino medical technology team proposing an affordable diagnostic system for rural healthcare. With a condescending wave of his hand, Dr. Klaus Weber declared that developing nations should stop trying to innovate and simply import proven Western solutions. What he didn't anticipate was that within 18 months, that same Filipino system he mocked would save his career and transform healthcare delivery across the Middle East. Dr. Weber was 47 years old, a celebrated interventional cardiologist who had trained at Heidelberg University and practiced at some of Europe's most prestigious hospitals before accepting a lucrative position in Dubai. His specialty was complex cardiac procedures using cutting-edge robotics and imaging systems that cost millions of dollars. He represented everything modern medicine aspired to be: precision instruments guided by decades of research, protocols refined in world-class facilities, technology that pushed the boundaries of what was medically possible. His patients were wealthy elites from across the Gulf region who flew to Dubai specifically for his expertise, paying premium prices for access to the most advanced cardiac care money could buy. The medical conference where this story begins was Arab Health 2024, one of the world's largest gatherings of healthcare professionals and medical technology companies. Over 3,000 exhibitors filled the Dubai World Trade Center, showcasing everything from AI-powered diagnostic tools to revolutionary surgical robotics. Among the thousands of attendees was a small delegation from the Philippines, led by Dr. Maria Santos, a public health specialist who had spent 15 years developing telemedicine solutions for remote Filipino communities. Her team had created something called the RxBox system, a portable diagnostic device that could capture vital signs, perform basic tests, and transmit data to remote physicians, all while operating in areas with unreliable electricity and internet connectivity. Dr. Santos presented their innovation during a session on accessible healthcare technology. She explained how RxBox had been deployed to over 450 rural communities across the Philippine archipelago, places where the nearest hospital might be a full day's journey by boat or mountain trail. The system cost a fraction of traditional medical equipment, could be operated by trained community health workers with minimal medical education, and had already helped diagnose and manage thousands of cases of diabetes, hypertension, and other chronic conditions that would have otherwise gone undetected until they became life-threatening emergencies. The data showed remarkable results: reduced hospital admissions, earlier disease detection, improved medication compliance, all achieved in communities that international health organizations had written off as too remote and too poor to receive quality medical care. Dr. Weber sat in the audience, arms crossed, his expression growing more skeptical with each slide. When the question period arrived, he stood, his voice carrying the authority of someone accustomed to being the smartest person in any room. He questioned the reliability of diagnostics performed by non-physicians, suggested that the system's simplicity indicated inferior quality, and argued that poor countries would be better served by investing in proper hospitals and importing established medical technology from developed nations, rather than wasting resources on what he termed homemade solutions. His comments drew uncomfortable silence from much of the audience, but several other Western physicians nodded in agreement. Their expensive suits and confident postures suggested they shared his worldview.
Dr. Santos responded with characteristic Filipino grace, acknowledging his concerns while gently pointing out that traditional approaches had failed to reach the communities her system served, that millions of people worldwide lived beyond the reach of conventional healthcare infrastructure, and that innovation often came from addressing real problems with practical solutions rather than waiting for ideal conditions that might never materialize. She invited Dr. Weber to review their clinical data, to speak with the physicians who supervised the system remotely, to understand that sophisticated medicine didn't always require sophisticated price tags. He declined politely but dismissively, clearly considering the conversation closed, the verdict rendered. Developing world innovation simply couldn't match developed world standards. 6 months passed. Dr. Weber continued his practice in Dubai, performing complex procedures, publishing papers, maintaining his reputation as one of the Gulf region's premier cardiac specialists. Then came a request that would change everything. The Dubai Health Authority had launched an ambitious initiative to extend healthcare coverage to migrant workers living in remote labor camps spread across the Emirates' desert regions. These camps housed hundreds of thousands of construction workers, mostly from South Asia and Southeast Asia, who built Dubai's towers and infrastructure, but lived far from its gleaming hospitals. The workers suffered high rates of heat-related illness, untreated diabetes, cardiovascular disease, and workplace injuries, but visiting medical facilities meant losing wages and risking job security. The health authority approached Dr. Weber to lead the cardiac care component of this initiative. The challenge was straightforward but daunting. How do you provide specialist medical oversight to a dispersed population living in basic accommodations scattered across vast distances with limited transportation and communication infrastructure? Traditional telemedicine systems designed for Western hospitals required stable high-speed internet, trained medical personnel on both ends, and expensive equipment. None of these conditions existed in the labor camps. Dr. Weber spent weeks exploring conventional solutions, video conferencing systems, mobile clinics with full diagnostic equipment, proposals to bus workers to central facilities. Everything he tried was either prohibitively expensive, logistically impossible, or required infrastructure that simply didn't exist. Frustrated and facing pressure from the health authority to deliver results, Dr. Weber found himself remembering that conference presentation he had dismissed months earlier. He tracked down Dr. Santos's contact information and sent an email he never imagined writing, asking if her RX box system might work in the UAE desert camps, admitting that he needed help solving a problem his expensive training and prestigious credentials hadn't prepared him for. Dr. Santos responded within hours, gracious and professional, offering to demonstrate the system and help adapt it to Middle Eastern conditions. Within 2 weeks, she arrived in Dubai with her technical team, bringing several RX box units and a wealth of experience implementing healthcare solutions in challenging environments. What happened over the following months transformed Dr. Weber's understanding of medicine and innovation. The Filipino team deployed RX box units to 30 labor camps, training camp supervisors and volunteer workers to operate the devices. Within weeks, the system was identifying workers with dangerously high blood pressure, undiagnosed diabetes, cardiac arrhythmias, and other serious conditions. The data transmitted to a central monitoring center, where Dr. Weber and other specialists reviewed cases, provided treatment guidance, and flagged patients requiring immediate hospital transfer. The system worked flawlessly in conditions that would have defeated conventional telemedicine. It operated on solar power when grid electricity failed, transmitted data over basic mobile networks, and required minimal technical expertise from the camp-based operators. The results exceeded everyone's expectations. Hospital admissions for preventable cardiac emergencies dropped 40%. Workers with chronic conditions received consistent monitoring and medication management. Workplace health incidents declined as underlying conditions were identified and treated early.
The health authority documented cost savings in the millions of dirhams, while simultaneously improving health outcomes for a vulnerable population that had previously received minimal medical attention. Dr. Weber wrote detailed reports crediting the RxBox system and the Filipino team's expertise, presenting the data at medical conferences and publishing findings in cardiology journals. The story attracted international media coverage, with headlines praising Dubai's innovative approach to migrant worker healthcare. But the real transformation was personal. Dr. Weber spent hours working alongside Dr. Santos and her team, learning how they had designed the system through years of trial and error in Filipino villages, how they had solved problems he had never encountered because his entire career had unfolded in well-resourced hospitals. He discovered that innovation wasn't about having the most expensive equipment or the fanciest facilities. It was about understanding the actual problem deeply and creating solutions that worked in real-world conditions with real-world constraints. The Filipino approach emphasized reliability over sophistication, usability over complexity, affordability over prestige. These weren't compromises or shortcuts. They were conscious design choices based on serving populations conventional medicine had abandoned. Dr. Weber began advocating for affordable medical technology and implementation of systems like RxBox across other Gulf states. He collaborated with Dr. Santos on research projects, studying health outcomes in underserved populations. He completely restructured his thinking about what constituted quality medicine, recognizing that a simple device that actually helped people was infinitely more valuable than an expensive system that remained inaccessible to those who needed it most. His colleagues noticed the change. The famous German cardiac surgeon who once dismissed developed world innovation now championed it, citing Filipino ingenuity as a model for addressing global healthcare inequity.
The partnership expanded beyond the labor camps. Dubai hospitals began integrating RxBox technology into their outreach programs. Other emirates requested similar implementations. International health organizations studying the Dubai project started deploying Filipino-designed telemedicine systems in refugee camps, disaster zones, and remote communities worldwide. What had started as a conference presentation dismissed by an arrogant specialist became a case study in how innovation emerges from necessity. How brilliant solutions often come from people solving their own community's problems, rather than from prestigious institutions designing for hypothetical scenarios. Dr. Weber and Dr. Santos eventually co-authored a landmark paper on accessible cardiology in resource-limited settings, presenting it at the European Society of Cardiology Congress to an audience of thousands. In his presentation, Dr. Weber openly discussed his initial dismissal of the RxBox system, his prejudice against technology from developing nations, and the humbling journey of discovering that some of medicine's most important innovations were happening far from the world's wealthy medical centers. He talked about how his expensive German training had prepared him to use sophisticated tools, but not to question whether those tools were the right answer for every problem. The presentation received a standing ovation and sparked conversations about medical innovation, technological appropriateness, and the importance of learning from diverse sources. The story carries important lessons about assumptions, expertise, and where innovation truly comes from. Developed nations don't have a monopoly on medical advancement. Some of healthcare's most transformative innovations emerge from people working with limited resources to solve real problems for real communities. Dr. Weber's expensive training and prestigious credentials were valuable, but they came with blind spots that prevented him from recognizing brilliance when it didn't match his expectations. Dr. Santos and her Filipino team possessed expertise born from necessity, from spending years actually serving communities conventional medicine ignored, learning what worked through iteration and adaptation rather than through theoretical models.
For anyone interested in healthcare innovation, global health, or the broader questions of how we define medical excellence, the encounter between Dr. Weber and Dr. Santos offers profound insights. It reminds us that expertise takes many forms, that practical experience solving real problems often produces better solutions than theoretical knowledge applied from distance. It demonstrates that innovation flourishes when we listen to people closest to the problems, rather than assuming solutions created in wealthy centers will automatically work everywhere. The German doctor who flew to Dubai confident in Western medicine's superiority left transformed by Filipino ingenuity, forever changed by his willingness to admit he was wrong and learn from those he had underestimated. Medical progress requires not just technical skill, but also humility, curiosity, and openness to learning from anyone who has something genuine to teach.